The diagnostic process for me was pretty quick and simple. I feel like I just didn't take it seriously. I had an ENT at Zoom Care diagnose me with trigeminal neuralgia and prescribed me with amitriptyline, and I just went home and Googled it and thought, that can't be me. This can't be my life.
Ron said, I was lucky that my diagnostic process was not drawn out. My primary care doc tried treating me for some more common causes of facial pain and had me get a checkup at the dentist. When nothing else was found, I was diagnosed with trigeminal neuralgia. It was confirmed by a neurologist and I was sent for an MRI. Nikki said, it was super difficult to get a proper diagnosis and is still difficult to this day going to new neurologists when moving as much as I have. For years, I was basically told this was in my head, take Tylenol, etc. I had one doctor cauterize my nasal cavity to try and stop the pain, which only exacerbated the issue. Finally, after about 5 years, I went to Cedars-Sinai in Los Angeles, where I was clinically diagnosed with TN and set on a path of Tegretol and steroids for quite some time. After a few years of little pain management help and more mental health baggage, I decided to stop the steroids altogether and just deal with it. I have been inhaling marijuana and eating THC gummies for years now as a coping mechanism. Since the diagnosis, I've seen a few other neurologists who did not believe I was properly diagnosed and therefore wanted to take me on their scientific path, which I declined. Eve said, after numerous ER visits, ENTs, and being diagnosed with tension migraines, I decided to see a neurologist who did countless MRIs and X-rays and didn't find anything. In that time, the pain in my throat got worse. I was admitted to the hospital for pain every month from December till April. In April, a team of neurologists diagnosed me with glossopharyngeal neuralgia. Before that, I was Googling symptoms and kind of already knew what it was, but was hoping it was a case of tonsillitis. It was the hardest diagnosis. Teresa said, it took almost 2 years to get diagnosed. Everything was normal. Erin said, getting diagnosed with TN was actually pretty difficult. I've had MS for 10 years, so I have a foot team of neurologists. But even still, I had to get multiple MRIs, multiple other tests and scans, and multiple visits to be physically evaluated. It took weeks.
Getting a diagnosis was a long and difficult process for me, mostly due to my age. I saw specialist after specialist, had multiple scans, hospital stays, a lumbar puncture, and everything was coming up negative, so they finally referred me to a complex pain clinic. The doctor at the clinic asked me 2 questions that no other doctor had asked, and that was, where exactly is the pain in your head? Like which side is it on? And will it hurt if I touch your face? He diagnosed me in 10 minutes after being undiagnosed for almost a year. He was able to put me on the correct medication and referred me to an adult neurologist who confirmed the diagnosis.
Ken said, diagnosis was difficult and it took about 5 years. It was actually my GP that diagnosed it in the emergency room, which I attended when the pain was so intense that I could hardly walk and definitely couldn't speak. Ashton said, thankfully, I already had a phenomenal neurologist and headache specialist on board due to other chronic neurological conditions. I had a surgical complication a month prior to the onset of my TN pain. My neuro originally hoped the pain was due to swelling, so she prescribed a Medrol dose pack. She also wanted a brain MRI and a head and neck MRA. Based on all that, she diagnosed me with bilateral TN.
For me, the diagnostic process for trigeminal neuralgia was actually quite quick. I know others have gone years with doctors not knowing what was going on, but in my situation, I got a root canal, and a few days later, I was even in more pain around that tooth. So I called my surgeon. I said, I need to come in. You need to check this out because my face hurts. Like cold water and fans are hurting my mouth. It's hurting my tooth. So I go in and she just taps a little bit on my face, and I was diagnosed on the spot. I almost screamed from the pain. And I thought, so did you do this, like, to the surgeon? Like, I have this all of a sudden because of this root canal? And she told me that TN was probably here all along, and that the root canal sort of just revealed those problems with my nerves. I said, okay, well, I'm gonna go get a second opinion from like a facial expert. And sure enough, they put me on gabapentin and it worked. And so, yeah.
Bianca said, "It was hell. I was the one that landed the diagnosis after extensive research. One day, I came across the TN hashtag on Instagram and saw a girl with oxygen in the same right side of her face shut down, including her eyelid. I DM'd her and finally saw the light at the end of the tunnel. I was officially diagnosed after finding my current neurologist back in 2018. Catherine said, "For me, getting a diagnosis was fairly easy. I first went to an ear, nose, and throat doctor. He thought it was TMJ, so I went to a dentist. The dentist said I was fine. Then I went to my primary care doctor, explained my symptoms, and he was able to diagnose me." Sydney said, "The diagnostic process was a long haul for me. Doctors first thought I had a severe ear infection, but after months of antibiotics and no stop in pain, they thought it was something more. After seeing 2 neurologists, getting a CT scan and 2 MRIs, they finally came to the conclusion of trigeminal neuralgia. This process took about 1.5 years. Mandy said, "I was lucky to get a fairly quick diagnosis overall. I was diagnosed in about a month. My primary doctor mentioned TN about 2 weeks in, and then I was referred to a neurologist and sent for an MRI. Between the MRI, the medication, and how my pain was presenting, I was diagnosed within about a month or so of my first attack of pain." Elma said, "It took about a year, multiple ER trips. Finally got insurance and saw multiple doctors and ended up getting diagnosed at the ER." Marvis said, "I went to emergency at one hospital and they asked questions. Told me it was TMJ with no x-rays. Gave me a shot of a pain med. I could not sleep. I was by myself, but had an appointment in the morning with a rheumatologist who's about 40 miles away. He diagnosed me with TN."
I remember going to the dentist to start with, and them trying to deal with it and using about 6 times as much Novocaine as was, normal, and even that left me completely shaking in the chair in pain. So I was lucky in the fact that I have been going to a neurologist for many years. I have chronic migraines, and they used to be at a daily point. So I'm pretty used to, continuous pain, but this was a completely different level. And I think because my neurologist had a baseline of the pain I could tolerate, that it was taken a bit more seriously than, say, if I was going to a new doctor. So I think I got lucky in how quickly I was able to get diagnosed. And then the thing that took some time was switching to getting a pain specialist instead of just neurologist. So that has helped a lot.